Welcome. DentalWriter is a tool for narrative report writing and medical billing for dentists. DentalWriter will help you create all the documents that you need, along with our support here at Nierman Practice Management, to get paid for medical insurance for various things such as dental sleep medicine, sleep apnea appliances, TMJ disorder, and oral surgeries, including bone grafts, implants, frenectomies, and extractions, as well as some other things that will be considered medically necessary by insurance companies. So the real workhorse of DentalWriter is your narrative report writer and your claim form generator, because what that's going to do is, in your four-step process, by filling out or having the patient fill out a dedicated questionnaire, whether it's sleep apnea, TMD, or oral surgery, and then entering your exam data in a medical necessity format, you can easily create your documentation, your SOAP reports of medical necessity, and as step 4, generate your claim form. The questionnaire is available as your own personalized link so that you can send the link to the patient to fill out the dedicated questionnaire or put the link on your website. This is an example of what the online patient forms powered by DentalWriter look like. Very easy for the patient to complete. Once they finish, this information is going to populate right in DentalWriter software. And these are the things that we know the insurance company wants to see, that we need to document in order to get paid by medical insurance in the dental practice for sleep apnea appliances. I'm going to take you back to the DentalWriter so that you can bring that information up from the online form and perform the other steps. So the DentalWriter software is, as I mentioned, a questionnaire and exam. Let's go into the sleep history exam and workup, and we'll show you what's wanted and needed by the insurance company. Again, as I click edit, you can see that this is the information that we got when the patient filled it out. It's right here in DentalWriter, and now it's writing your narrative report section by section as you go. The next step on the questionnaire will be entering any medical history, such as high blood pressure, which is important to document for OSA, as well as the Epworth Sleepiness Scale, which is the questionnaire that insurance companies use to determine if the patient has excessive daytime sleepiness. So there's a reason for every checkbox. The insurance will want to see the RDI and the AHI. They'll want to know, in order for you to get paid, if the patient either refused CPAP or tried CPAP and was intolerant to it, and any other therapy attempts that the patient has tried, so that they can determine if the patient's a candidate for oral appliance therapy. Additionally, the treatment history will allow you to know who to send the reports to, what physicians the patient's seeing. So once you see the narrative reports, you'll see that these are appropriate not only to get paid by medical, but to also communicate with the patient's physician, such as their primary care doctor or their sleep physician. And as we go through the questionnaire, very easy to enter the sleep history. And again, DentalWriter pulls everything together into a beautiful report for you. The next step will be your exam. Simply go through and indicate, we're going to keep the oral exam just if they're a candidate for oral appliance therapy, keep that simple to get paid by medical. We're going to go through the airway exam, including examination of the tongue. Could have a scalloped tongue or enlarged tongue. We look at the tongue level above the occlusal plane, your Mallampati classes, and your tonsil grades. Additional airway items are uvula could be elongated or obstruct the airway. The soft palate could have loss of tone. Could be a moderately vaulted maxilla and a micrognathic mandible. There's also a TMD screening that you can indicate that you did do a baseline muscle palpation screening, baseline crepitus and clicking screening, as well as range of motion measurements. Very important to have that baseline. When we get to the assessment, I'm going to say patient is a candidate for oral appliance therapy, patient's undergone a sleep study, and now I've got my diagnosis from the sleep study. Let's going to write this in your narrative so the insurance company has the codes. And DentalWriter's also linking this ICD-10 diagnosis code for OSA right to the medical claim form. It's building your claim form as you go. We'll enter clinical data such as your bites and impressions, also your plan. Very important to give the insurance company enough information about the type of appliance and the calibration processes that you plan, as well as sentences set up for you for oral appliance delivery, physician follow-up, treatment options discussed, and counseling and consent. At this point, I'm going to go to services, and I'm going to utilize the medical billing CPT codes to bill for any imaging that I did today. So as I click this, it's writing in your narrative that you completed this imaging, and it's also, in addition to linking the ICD-10 code, it's linking these codes to the medical claim form. And I'm also going to say we did a level 3 exam today and use the medical code for that. And so that's creating that on your claim form too. At this point, we're going to go ahead and we're going to generate your narrative report of medical necessity. And then we're going to go grab the claim form and you'll be good to go. And again, there's a reason for everything we put in DentalWriter so that you have the documentation right from the get-go before the insurance company decides that they don't have enough information. So we've got the subjective information for that patient, the objective exam findings. You can see it's all building from those check marks that you put in the questionnaire and exam, your assessment with the codes in it, and your plan with the CPT. So it does a beautiful job creating that narrative, not only for insurance companies, but this is very, very important to send to any physicians the patient has. And it's a great practice builder to show the physicians that, yes, you know what you're doing, you've got the medical coding, and that you are the guru in your area. Next, we're going to go in DentalWriter to step 4, which is simply the medical claim form. So everything that I had indicated that we did today is going to now complete the medical claim form with the patient's demographics filled out perfectly. The diagnosis has come over. And so those of you not familiar with medical billing, DentalWriter just does it easily for you right from your dedicated exam, whether it be sleep, TMD, or oral surgery. So today I'm billing the cone beam here for $450, and I'm billing my exam for $175. Now, when the patient comes back, it's real easy to add the sleep apnea appliance code and to bill for that. It's billed upon the delivery. So as you can see, DentalWriter takes a process that may have a little bit of learning curve, and that, along with the world of support that Nierman Practice Management provides for you, helps you get paid by medical insurance. The Help Center is very good. We do have people you can contact at any time. Live webinars will get your practice going, as well as the hands-on remote training that we do. DentalWriter training videos are available 24/7, as well as the forum and knowledge base for medical insurance in dentistry, the only knowledge base out there for dentist billing medical insurance. The study club library has 60 recordings of study clubs, whether they be clinical study clubs for TMD, implants, or sleep apnea, and also medical billing recordings that are anywhere from a few minutes to an hour long. So those are available at any time, as well as the cross-coding tool, where you can cross-code by placing a dental code in, and it'll give you claim examples for that in medical insurance. And so as you can see, DentalWriter is going to solve any issues that you have with medical billing by providing the right documentation and the right support to get you paid by medical insurance.